You are walking through a busy train station on a normal Tuesday afternoon. Out of nowhere, your chest tightens up and your heart starts hammering wildly against your ribs. Your brain immediately flashes to a single terrifying question: am I having a fatal heart attack? Society often dismisses anxiety as something that is simply in your head, but the physical pain you feel in that moment is a biological reality. Severe anxiety triggers your body's stress response. This is an evolutionary alarm system that produces intense physiological outputs, creating physical sensations that mimic an acute cardiac or respiratory emergency. Moving through this experience requires pausing the emotional response and looking at your body's physical data objectively to identify what your alarm is signaling. To understand why this response causes physical pain, we have to look at your internal environment the moment an anxiety spike occurs. It starts with a chemical trigger. Your bloodstream is suddenly flooded with stress hormones, specifically adrenaline and cortisol. This anatomical diagram shows the mechanical consequence. When those hormones bind to receptors, your heart muscle rapidly accelerates, and the muscles in your chest wall begin to painfully constrict. This system-wide alarm also overrides your lungs. You begin taking rapid, shallow breaths, which disrupts the balance of oxygen and carbon dioxide in your blood. This leads to sensations of air hunger and severe dizziness. This biological cascade also diverts resources away from non-essential functions. Because of the direct connection between your gut and your brain, you may also experience sudden nausea or digestive pain. These symptoms are driven by mechanical forces. Because they follow a specific biological pattern, we can use a diagnostic framework to differentiate them from a failing heart. Emergency room doctors use a process called a differential diagnosis to isolate the true cause when two branching paths share similar symptoms. Looking at this chart, we can map out the two profiles. On the left, anxiety pain typically presents as a sharp, stabbing sensation or a localized dull ache. This pain has distinct physical markers. It remains anchored in one spot, and the chest wall often feels tender when you press on it with your fingers. There is also a specific timeline for this pain. It steadily improves as you begin to rest and calm your breathing. On the right side is the cardiac profile. Heart attack pain is rarely sharp. It is instead felt as a heavy, crushing pressure or intense squeezing. Instead of staying in one spot, cardiac pain radiates. It spreads from the chest into the arms, jaw, neck, or back. Timing provides another key distinction. Cardiac pain does not improve with rest, remains intense, and is frequently accompanied with heavy sweating. Applying this diagnostic split helps move the experience from a state of chaotic terror to a physiological situation that can be managed with specific actions. Once the differential diagnosis indicates a false alarm, the objective shifts to using physical techniques to force the nervous system to reset. You can trigger a biological override using the 4-7-8 breathing protocol, which is designed to lower your heart rate. Follow the rhythm of this timer. Inhale through your nose for 4 seconds. Hold that breath for 7 seconds. Then exhale slowly through your mouth for 8 seconds. However, if these breathing techniques do not provide relief, or if your symptoms align with the cardiac profile, the diagnostic process ends and you must act immediately. Seek emergency care if you experience crushing, radiating pain, severe shortness of breath that does not improve, a sudden thunderclap headache, or unexplained numbness. Arka Anugraha Hospital in Bangalore provides a clinical safety net for these moments, offering 24/7 emergency care along with medical management and counseling to address the underlying causes of anxiety. While the physical manifestations of anxiety are real and distressing, identifying their biological patterns allows you to address them through clinical care and management techniques.